Several years ago, I had a community member approach me and talk to me about his experience with cancer. His wife had cancer, and she was being treated at one of the university hospitals in the Bay Area. And the last trip that they tried to make over the Bay Bridge didn't turn out well. She got very ill in the car, and he had to turn around and bring her back home. And he was very unhappy, and he said, "Marcy, you talk about being committed to this community. You have to change this. You have to bring the care here. We can't make those trips anymore."
Things are different now. We have a comprehensive cancer center here right in Pleasanton at ValleyCare, and we have university-level expertise. We have state-of-the-art treatments available. We have access to clinical trials. We have many of our physicians have come right out of academic medicine and have planted here to build a strong program, and we're very proud of that.
I have the pleasure of working with a lot of other great doctors, and we're also in constant contact with surrounding academic institutions. So we keep in touch with what's the latest and greatest in patient care, in diagnostics, in tests or procedures that are available. And I think we have a really great community presence, which is very important because these are the people that we want to take care of in our own community.
One of the things that we have done here at ValleyCare that's very different, I believe, for a community hospital is we have established a university affiliation with UC Davis, which has a world-renowned cancer treatment center.
So we wanted to be part of that. We wanted our patients to be part of that. We wanted our patients to be at the, at sort of the crest of the wave, at the cutting edge of cancer delivery. So that's where the UC Davis affiliation helped, because we were able to open multiple clinical trials here that our patients can access without having to travel outside the community. The second aspect of that affiliation is the professional dialogue through the virtual tumor board. Now, these tumor boards are actually very unique to cancer medicine. There is no other subspecialty out there where physicians bring their patient cases to a roundtable conference where other physicians also sit and hear about the case and participate. And at the end of it, there's a consensus opinion on what should be done next.
We've invested in technology, the latest in radiation therapy, the latest in chemotherapy. And so for me, I was sorry that we waited so long to make that commitment, that it took a community member to come and say to me, "You need to do something about this."
So many times I think it's overwhelming for patients when they're diagnosed with something that even possibly could be cancer. So most of my job is just to help them feel empowered about what they can do.
I was first introduced to her when I was going through chemo at the ValleyCare Cancer Center. Like I told Mary, I says, I've never cried before. When I got diagnosed, never cried. But now I feel like crying. I didn't feel like I was so lost anymore.
Where I find navigation has made the biggest difference for our patients is they have a real person to talk to along the way, and someone that can answer questions for them, offer support, educate them on how to prepare for each test, when the test results are going to be in, and what they need to do about it.
She had all these various programs going on, and she definitely led me to the support group. I was hesitant at first because I just didn't want sad people being around, because this was a bad time, and I didn't want to be around sad situations all the time. So I told her, well, it's not for me just yet. But she kept giving me some of these brochures and kept me informed on things. Finally, I went to the support group. Best move I ever made.
I sit among giants when I sit in the cancer support group, to hear them laugh and what they've had to go through and how they find humor and encouragement for each other. I'm humbled every time I'm there. It just makes me feel like I can't give enough back for what they've given me.
I'm doing great. I have good outlook on things. Something I've learned too is find anything that makes you laugh. That helps. And just enjoy life.